Every year, hundreds of thousands of people have a serious cardiac event without ever experiencing the dramatic, chest-clutching moment that movies have trained us to expect. The real warning signs are quieter, subtler, and far easier to dismiss. And most people do dismiss them, for months, sometimes years, before something serious happens. Most people over 50 believe that if their heart was in real trouble, they would know it. They would feel something unmistakable, a crushing chest pain, a sudden collapse, an obvious emergency. But cardiologists have documented for decades that the majority of serious heart-related events are preceded by symptoms that felt minor, intermittent, or easy to explain away. A little breathlessness going up the stairs, some fatigue that seemed like age, a strange feeling in the jaw or shoulder that came and went. People waited. They assumed. They told themselves it was nothing. And for too many of them, that assumption cost them everything. Your heart rarely screams before it breaks. It whispers, and most people have never been taught to listen. Think about the last time you felt unusually tired after doing something that used to feel easy. Or the last time you felt a little short of breath and told yourself you were just out of shape. Or the last time there was an odd pressure somewhere in your upper body that you could not quite explain, and you waited to see if it went away, and it did, so you forgot about it. That pattern, notice, dismiss, forget, is one of the most dangerous patterns in heart health. Not because every one of those moments is a crisis, but because some of them are the body's earliest and clearest attempts to get your attention before something serious develops. Today we are going to talk about 3 specific symptoms that deserve that attention, what they feel like, what they mean, and exactly when to act. Here is what we are going to cover today in plain, clear language. The heart is a muscle, and like any muscle under sustained stress, it gives signals when something is wrong. But the signals the heart sends are often misread, misattributed, or missed entirely, particularly in people over 50, and particularly in women, whose cardiac symptoms are documented to present differently from the classic picture most people recognize. We are going to walk through 3 specific symptoms: unusual fatigue, shortness of breath, and atypical discomfort or pressure, and explain what each one can mean at the cardiac level, what the research says about how these symptoms appear, and what the difference is between something that can wait and something that cannot. By the end of this video, you will know exactly what these 3 symptoms feel like in real life, why they are so frequently dismissed, and why that dismissal is dangerous, and what to do when you notice them, not out of panic, but out of informed, calm, empowered awareness. This information could be the most important thing you watch this year. This video is for educational purposes only, and is not a substitute for personal medical advice from your own doctor. If you are currently experiencing any of the symptoms discussed in this video, please contact your healthcare provider or emergency services immediately. Do not delay seeking medical care based on anything shared here. Symptom number 1. Unusual and unexplained fatigue. The first symptom is the one most consistently overlooked, not because it is subtle, but because it is so easy to blame on everything else. We are talking about unusual fatigue, a tiredness that is different from ordinary tiredness, that does not improve with rest the way normal tiredness does, and that represents a real and documented departure from a person's previous energy baseline. Here is why this type of fatigue happens and what it means at the cardiac level. The heart's primary job is to pump oxygenated blood to every tissue in the body: muscles, organs, brain, and everything in between. When the heart is under stress, whether from narrowed coronary arteries reducing blood flow, from early-stage heart failure reducing pumping efficiency, or from electrical rhythm disturbances affecting how effectively the heart contracts, it begins to struggle to meet the body's oxygen demands. The body responds by directing whatever oxygenated blood is available toward the most critical functions and away from everything else. Muscles receive less oxygen. The brain receives less oxygen. And the subjective experience of that reduced oxygen delivery is an overwhelming, persistent, unexplained exhaustion. What makes this fatigue distinctly different from ordinary tiredness is its quality and its context. Ordinary tiredness has an obvious cause: a poor night of sleep, a demanding day, significant physical exertion. It responds to rest. It clears up. Cardiac-related fatigue is different. It appears after activities that previously required no effort at all. Walking from one room to another, carrying a light bag of groceries, climbing a single flight of stairs. It does not respond to rest in the expected way. A full night of sleep does not restore the energy, and it tends to be progressive, gradually worsening over weeks or months as the underlying cardiac issue continues to develop. This pattern of fatigue is particularly important to understand in women over 50. Research in cardiovascular medicine has established clearly that women are significantly more likely than men to experience fatigue as a primary or even sole symptom of serious cardiac conditions, including heart attack, without the accompanying chest pain that most people associate with heart emergencies. Studies examining women who experienced heart attacks found that the majority reported unusual fatigue in the days and weeks before the event, fatigue they had attributed to stress, aging, hormonal changes, or simply being busy. This is not a minor distinction. It is a critical one. A woman over 50 experiencing unexplained, persistent, progressive fatigue that represents a real change from her normal baseline has a specific and documented reason to discuss that symptom with her doctor. Not in 6 months, but promptly. For both men and women, the key question to ask yourself about any fatigue is this: is this my normal, or is this different? Has something changed in the last few weeks or months? Is there a new ceiling on what I can do without becoming exhausted? Those questions cut through the noise of everyday tiredness and identify the pattern that is worth paying attention to. Cardiac conditions identified at the fatigue stage, before a serious event occurs, are among the most successfully managed conditions in modern medicine, with excellent outcomes when caught and treated early. Paying attention to this symptom is not overreacting. It is exactly what doctors want you to do. What fatigue looks like in real life and when to act. Let us make this even more concrete, because the difference between ordinary tiredness and cardiac-related fatigue can sometimes be hard to describe, but is very real when you know what to look for. Cardiac-related fatigue often comes with a sense of heaviness, not just in the muscles, but throughout the entire body. Simple tasks feel effortful in a way they never did before. Some people describe it as feeling like they are moving through water. Everything takes more out of them than it should. Others notice it most in the morning, waking up feeling as though they have not slept at all, regardless of how long they were in bed. Another important version of this fatigue pattern is what happens during and immediately after mild physical activity. If climbing stairs, walking a moderate distance, or doing light household tasks leaves a person noticeably more breathless or tired than it would have 6 months ago, and this change is consistent and progressive, that is a signal that deserves evaluation. The cardiovascular system's ability to meet the demands of mild activity is one of the most sensitive early indicators of cardiac function. When that capacity declines noticeably, something is changing, and that change is worth identifying early. The time to act is not when fatigue becomes unbearable. The time to act is when it is new, persistent, and different from what is normal for that person. A phone call to a doctor, a clear description of the change, and a request for an evaluation, including an EKG, a cardiac stress test if indicated, and blood work that includes markers of cardiac stress, is the appropriate and potentially life-saving response to this symptom when it fits the pattern described. Symptom number 2, shortness of breath that does not match the effort. The second symptom is one that even more people dismiss because it feels like it has an obvious explanation. Getting older, being less active, carrying extra weight, all of these feel like sufficient reasons to become a little more short of breath. And sometimes they are. But there is a specific type of shortness of breath that is not about fitness level at all, and learning to recognize the difference can be genuinely life-saving. Cardiac-related shortness of breath occurs when the heart is not pumping blood efficiently enough to keep fluid from backing up into the lungs. When the left side of the heart weakens or becomes stiff, blood can pool in the pulmonary circulation, the blood vessels that run through the lungs. That pooling increases pressure in those vessels, which pushes fluid out of the blood vessels and into the lung tissue itself. The lungs, which are normally air-filled and highly elastic, begin to stiffen with fluid. Breathing becomes harder, not because the airways are blocked, but because the lungs themselves are becoming congested from the inside. What does this feel like in real life? In early stages, it feels like an inability to catch your breath after mild exertion. Climbing stairs, walking up an incline, carrying something moderately heavy. The breathlessness seems disproportionate to the effort involved. A person who used to walk briskly through a parking lot without difficulty now finds themselves pausing to catch their breath before entering the store. The distance they can walk before needing to slow down has shortened noticeably over recent months. As it progresses, cardiac-related shortness of breath begins to appear in situations that previously required no exertion at all. Getting dressed in the morning. Talking on the phone while standing. Moving from one room to another. Some people notice it most when lying flat, where lying down causes fluid to redistribute in the lungs and breathing becomes more difficult. People experiencing this often find themselves sleeping with more pillows to keep their head elevated without fully understanding why. This is a specific and significant cardiac symptom that warrants prompt medical attention. Another very specific version of cardiac breathlessness is waking up suddenly in the middle of the night feeling short of breath, sometimes with a sense of air hunger or mild panic that resolves after sitting up for a few minutes. This is one of the more recognizable signs that fluid is accumulating in the lungs during sleep, and the body is being forced to wake up to manage it. If this has happened to you more than once, it belongs in a conversation with your doctor, soon. Some people are thinking right now, surely I would know the difference between being out of shape and something being wrong with my heart. The honest answer is that without knowing what to look for, most people genuinely cannot tell the difference. And that is exactly why so many serious cardiac conditions go undetected for years. The pattern, the progression, and the context are what separate ordinary breathlessness from a cardiac signal worth acting on. When shortness of breath becomes an emergency, understanding the difference between shortness of breath that warrants a scheduled doctor appointment and shortness of breath that requires calling emergency services immediately is critically important. A scheduled appointment, prompt, within the next few days, not next month, is appropriate when shortness of breath is new and progressive but manageable. When it appears with mild exertion, has been gradually worsening over weeks, and is not accompanied by chest pain, sudden severe onset, or other alarming symptoms. In this case, a prompt evaluation for cardiac function is the right and responsible response. Emergency services should be called immediately when shortness of breath comes on suddenly and severely, especially when combined with chest pain or pressure, pain radiating to the arm, jaw, neck, or back, sudden sweating, nausea, or a feeling that something is seriously and urgently wrong. These combinations of symptoms can indicate an acute cardiac event that requires immediate intervention. Every minute that passes during an active cardiac event affects how much heart muscle survives intact. This is not an exaggeration. It is cardiovascular physiology. For people over 50 with known risk factors, high blood pressure, diabetes, high cholesterol, a history of smoking, a family history of heart disease, or significant weight carried around the midsection, any new and unexplained shortness of breath should be evaluated promptly. These are not people who should wait and see. These are people who should pick up the phone. Have you noticed that activities which used to feel easy now leave you more breathless than they should? And have you mentioned it to your doctor yet? A yes or no in the comments is enough. Your answer might give someone else the push they need to finally make that call. Symptom number 3, atypical discomfort, pressure, or pain. The third symptom carries the most misunderstanding, and that misunderstanding has cost more lives than almost any other gap in public health knowledge. We are talking about the discomfort, pressure, or pain associated with cardiac stress. And the reason it is so frequently missed is that it so rarely looks like what people expect. The classic picture of a heart attack, a sudden, crushing, vice-like pain directly in the center of the chest, is real, and it happens. But it represents only one version of how the heart communicates distress. Cardiac-related discomfort can present as a dull ache, a feeling of pressure or squeezing, a tightness, a heaviness, or even simply an uncomfortable sensation that is genuinely difficult to describe. It can be located in the center of the chest, the left chest, or sometimes nowhere near the chest at all. Cardiac discomfort can present in the jaw, particularly the lower jaw, and is frequently mistaken for dental pain. It can present in the left arm, but also in the right arm, in both arms simultaneously, or in neither arm. It can present in the upper back between the shoulder blades. It can present in the upper abdomen, where it is commonly mistaken for indigestion, acid reflux, or a stomach problem. It can present in the throat or neck as a sense of tightness or pressure that seems completely unrelated to the heart. These are not unusual or rare presentations. They are documented and well-studied patterns that cardiologists see regularly. The reason cardiac discomfort refers to these locations is related to how the nervous system processes pain signals. The heart and many of these areas share nerve pathways, which means the brain can misinterpret where the signal is originating. This is called referred pain, and it is one of the most clinically important concepts in recognizing cardiac symptoms in real life. What makes cardiac discomfort specifically recognizable, regardless of where it is located, is its relationship to exertion and its pattern of behavior. Discomfort that appears predictably during physical activity and resolves with rest is called angina, and it is a direct signal that part of the heart muscle is not receiving adequate blood flow during the increased demand of activity. This pattern, predictable onset with exertion, relief with rest, is one of the most diagnostically significant symptom patterns in all of cardiology. It should never be explained away as a muscle strain, a digestive issue, or normal aging without cardiac evaluation first. For women over 50, atypical cardiac presentations are even more critical to understand. Research consistently documents that women experience heart attacks with atypical symptoms more frequently than men, with nausea, extreme fatigue, jaw pain, upper back pain, and a general sense of feeling deeply unwell being more prominent than the classic chest pain presentation. A woman over 50 who experiences any unexplained combination of these symptoms, particularly during or after exertion, has a specific, research-documented reason to seek cardiac evaluation. Not tomorrow, today. Modern cardiac care, when accessed at the symptom stage rather than the emergency stage, offers genuinely excellent outcomes, with treatments that can restore normal heart function and prevent serious events entirely. The best cardiac story is the one where something serious never happens because a symptom was taken seriously in time. Putting all three together and what to actually do. Now, let us bring all three symptoms together and talk about what to actually do with this information, because the entire point of this conversation is not awareness alone. It is awareness that leads to action. Unusual fatigue, unexplained shortness of breath, and atypical discomfort or pressure in the upper body are the three most commonly reported symptoms in people who are later found to have significant cardiac conditions that were developing for months or years before diagnosis. They are also the three symptoms most commonly explained away, most commonly attributed to aging or stress, and most commonly left unmentioned at routine medical appointments, either because the person did not think to bring it up or because they felt it was not serious enough to report. Here is a simple and practical framework for deciding when to act. If any of these three symptoms is new, meaning it was not present 6 months ago, that alone is worth reporting to your doctor. If any of these symptoms is progressive, meaning it is gradually getting worse or appearing in situations where it previously did not, that is worth reporting promptly. If any of these symptoms appears during or immediately after physical exertion and then eases with rest, that specific pattern warrants a prompt medical evaluation. And if any of these symptoms appears suddenly and severely, or in combination with chest pain, sweating, nausea, or a feeling that something is seriously wrong, that is not a doctor's appointment situation. That is call for emergency services immediately. At a medical evaluation for cardiac symptoms, the tools available are genuinely powerful and non-invasive. An EKG can detect electrical abnormalities in the heart's rhythm and function. A cardiac stress test evaluates how the heart performs under controlled physical demand. Blood tests can detect signs of recent cardiac muscle stress. An echocardiogram, an ultrasound of the heart, can evaluate the structure and pumping function of the heart directly. These are straightforward, accessible evaluations that can identify or rule out serious cardiac conditions accurately and relatively quickly. The most important thing a person over 50 can do with the information from today's video is this. Think honestly about whether any of these 3 symptoms has been present in your life recently. Think about whether you have been explaining it away. And if the honest answer is yes, make the appointment this week. Write down what you have been noticing, when it happens, how long it has been present, and whether it is getting worse. Bring those notes to your doctor. That simple preparation can make a real clinical difference in how thoroughly your concern is evaluated and how quickly the right action is taken. Before we close, I want to hear from you. Out of these 3 symptoms, unusual fatigue, unexplained shortness of breath, and atypical discomfort or pressure, is there one that you have been noticing and quietly setting aside? You do not have to share any details. Even just saying, yes, the fatigue one, is enough. Your comment might be exactly what someone else needed to stop dismissing what their body has been trying to tell them. And if this video gave you something genuinely important today, please share it with someone you love. This is the kind of information that belongs in every home. Thank you for being here today. The heart has been working for you every single moment of your life, through every challenge, every loss, every joy, without ever asking for a moment off. What you learned today is a way to pay attention to it the way it deserves. Not with fear, not with anxiety, but with the calm, clear awareness of someone who knows what to listen for and what to do about it. Take good care of yourself. Take these symptoms seriously, and take care of the people around you by sharing what you learned today. Stay well, and I will see you in the next one.